going to demonstrate several interrupted patterns of external skin sutures. External skin sutures can be placed from right to left or left to right based on surgeon preference. In this case, I'm going to start at the right so that you can see a little bit better. I'm going to start within 5 millimeters of the end of the incision, and I'm going to come back 5 millimeters from the cut edge, pass the needle down through the tissue, just trying to get my skin layer and not my sub-Q along with it, and then come up about 5 millimeters across the cut edge. I'm going to gather my suture and tie what will be a simple interrupted suture. I am tying with nylon, which is a monofilament and rather slippery, so you'll see that the first throw tries to sort of pop back up and loosen. That's normal for nylon. I'm going to let it do that. When I pull down my second throw, that will tighten quite a bit. And so I tighten it most of the way on the second throw, but I still have a little bit of looseness there, a little bit of airspace in the knot. When I tie the third throw, I'm going to pull it snug so that the edges of the skin are opposed. Gently opposed but not wrinkled and not crunched because the skin will swell a little bit post-op. Then I'm going to lay on a fourth throw. Because these are external sutures, I'm going to leave the tails long because I'm going to have to take them out again later. Nylon is non-absorbable, so I choose to take about 1 to 2 centimeters and cut there. Some surgeons like to pull their knots so that they're not over the middle of the incision, and so that's something that you can do when you're getting ready to cut. This pattern would be continued at 5 millimeter increments all the way down the length of the incision. Another external skin suture pattern is a cruciate suture, so called because it creates an X. We're going to start by going 5 millimeters away from our first suture, and I'm going to come a little bit farther back, so maybe about 6 to 8 or even 8 to 10. And so I may need to come up in the center. In this case, I'm going to demonstrate how I would do that. So I'm going to draw suture through, and then I'm going to come across. And then when I create this, I'm going to come across the incision and match the bite on the far side. So in other words, instead of just tying that like I would for a simple interrupted, I'm in effect taking a simple interrupted bite a second time. So now I'm ready to do my 4 throws, and what I'll end up with is a large X. Again, my nylon's wanting to loosen up after I tie the throw, which is okay on the first throw. On the second one, I'm going to snug it down a little bit more. And on the third one, I'm going to draw it all the way tight to the level that I want. And my 4th throw goes on, and I cut the tails. So I have 1 centimeter tails. So my cruciate sutures suture an incision along the length a little bit faster than my simple interrupted do. The ideal cruciate is an X that looks like a tic-tac-toe X. In other words, it's as tall as it is long. Typically, what people will do is create smaller bites than what I did. I did these so that you could see them. Typically, people will create smaller bites back from the cut edge and then go a little bit more distance in between the 2 bites across so that that X will remain wide as opposed to being tall and narrow. Another suture pattern that may be useful is a horizontal mattress pattern, which is a tension relieving pattern. In this pattern, I'm going to take my needle and bring it about 5 millimeters back from the cut edge and pass it through and 5 millimeters out the cut edge here. So in other words, I've taken what would be a simple interrupted bite. But instead of tying it, I'm going to take my needle and my drivers and lock it facing away from me. In other words, I'm backhanding. You should only backhand in patterns when you need to, as it's a little bit less dexterous and a little bit more difficult. I'm going to come over about 5 to 8 millimeters and pass the needle backhanded through the tissue. And you can either come up in the center or you can go all the way across. In this case, that bite's rather deep, so I'm going to come up in the center. And then I'm going to gather and tie so that what I end up with is what looks like an equal sign on either side of my patient, being careful not to over tighten. This is an everting pattern, so if I over tighten, the skin edges are going to evert. In this particular case, what I want is gentle apposition so that this patient can heal. I'm going to tie my 4 throws and then go ahead and cut, again, 1 centimeter. So this is a horizontal mattress pattern. A vertical mattress pattern is the next one I'm going to tie. In this case, what we do is we start out quite far back from the cut edge. And so what we're going to do here is come at down in at 8 millimeters and come up through the center. So I usually go at 8, some people go at 10, somewhere in that range depending on the size of your patient. And then on my near side, at 8 to 10. And then now I'm going to reverse the direction of the needle and the needle drivers. So I need to do that for the horizontal mattress pattern and for the vertical. And then I'm going to, roughly speaking, split the distance between the cut edge and where the suture is coming out. So in other words, at about 3 or 4 millimeters from the cut edge, and go back. And split the distance on the other side as well. Then when I tie, what I've created are 2 lines that are perpendicular to the incision. This also is an everting pattern, so I want to be careful that I don't over tighten. It's also used for tension relieving, along with the horizontal mattress. Sometimes when you have more tension than what you want to use a horizontal and vertical mattress for, there's a variation, or a number of variations on the vertical mattress that can be more effective at relieving tension in the skin. One of those is a far, near, near, far. Some people will do a far, far, near, near, some combination of fars and nears, and I'll show you the far, near, near, far today. What you choose to do is, as the name implies, far, near, near, far. I'm going to start far away and come through my skin layer. So I'm going to start back 8 to 10 millimeters. And I'm going to come back, and then I do near, so I'm going to be now 3 to 4 millimeters. And then I'm going to come across to the other side, near, come up through the center, and far will be on my near side as well. Okay, and so now what I've created is a line that's going across, and as I tie this, it's going to come across yet again. Far, near, near, far, and other far, near variations are good tension relieving patterns. So you see, in contrast to the vertical mattress, where it doesn't appear on the top side to cross the incision line, you'll see the suture crossing the incision line twice on the far, near patterns, such as far, near, near, far.